Thank you everybody for joining in our Mass Gathering Special Interest Group webinar series. It's part of the webinars offered through the World Association for Disaster and Emergency Medicine. My name's Jamie Rance. I chair the Special Interest Group for Mass Gatherings at WADEM. And we've started up since meeting in Killarney at the World Congress recently, this webinar series again. So every 2 months we'll be holding a webinar from someone in a different location throughout the globe, speaking about something related to major events or mass gatherings and health. So the way that this will work today is, in a moment I'll introduce Anas, who will be leading our presentation. Throughout the presentation, feel free to use the question and answer section or the chat box to ask particular questions if you have them. And Anas will address those towards the end of his presentation. At the end of the presentation, we'll open up for questions related to the presentation, and then following those questions, we'll open up for questions related to mass gatherings in general, or anything to do with WADEM and the Mass Gathering Special Interest Group. So I'll hand over to Anas now. As I introduce him, Anas is the Director General for the Global Centre for Mass Gatherings Medicine within the Ministry of Health in Saudi Arabia. Anas has been quite active within this special interest group of WADEM and is a valued member of our leadership team. So I'd like to hand over now to Anas for his presentation. Thank you.
Thanks, Jamie, and thanks, Andrew, for arranging this session today. And I welcome everyone who is joining our session. Good day. I will be talking about legacy in global health security in the context of mass gatherings. So when we discuss mass gatherings, we have two major concerns or challenges that we need to assure that we are well prepared for. The first one is having such high numbers in unusual situation than the daily activities. So we want to make sure that their immediate needs are being addressed, that any urgent or emergencies being well prepared for in relation to response. And the other aspects, especially when you have international visitors attending these events, so you want to make sure that the health security, where there is no risk of transmission of infectious diseases across the borders when they finish or when they bring it on, when they visit the site of the event. So both, they go hand in hand. We want to make sure that across the journey of preparedness of any event or mass gatherings, that they are well addressed and taken care of. And when we proceed, as you see in our presentation, just a quick background about our center. It's a global center for mass gatherings medicine within the Ministry of Health in Saudi Arabia. Our aim, as we are collaborating with the WHO, is to generate evidence-based knowledge that will help to empower the body of knowledge in terms of developing standards, policies, and procedures, and that's with focus on risk assessment, resource tools for planning, and so on. We invest heavily in research studies with experience documentation and as well as capacity building, and we work heavily for international collaboration to make sure that we are exchanging our experience and engaging with many interested people among the globe to expand on this area of knowledge. So as we just discussed, when we discuss the mass gatherings, we have the public health area, and from there the challenge rises about the health security, as we just discussed, the curative service or the therapeutics or the clinical service delivery, if we say so. And that's, we want to make sure that from there it stems that our system for emergency preparedness for acute emergencies are being mitigated, and we have planned for response in case of such event rises. And from there, what we believe that we want to make sure that there is a legacy from these events. If you talk to any decision making, either in public policy, in management, or in even business. So what happens is that we want to make sure that the resources being allocated for one event with a specific duration is being taken care of, and that there is an sustainability in its impact. So the better that the outcomes are having sustainable impact, so that will be easier to convince the decision maker to allocate those resources. And from there, if you design all your activities in such scenario, it will pay off enormously. And in Saudi Arabia, we're very proud that this annual exercise, if we say so, has participated significantly in building our capacities, in testing our system and communication, in making sure that everyone knows everyone. I know my colleague, what he does, what he does not do, and what's the limitation and challenges that he faces. So when I ask or provide an ask in a time of an emergency, it's very specific and I know all the context around it. So that's very significant, and it paid off for Saudi Arabia during the pandemic. We are very proud of the pandemic response that took place across the system within the healthcare and in collaboration with other sectors. The governance, the communication, the coordination on a national level was at its highest because of this annual exercise. So I urge any event planner, anyone participates in any mass gathering events, to take those opportunities, not only as a single event where we just, okay, I have 3 days of the event, I want to get it over with. Let's do exactly what with that focus, and it ends at the 3rd day. With that in mind, we will lose the continuity, we will lose the experience, we will lose the continuity of all the assets that we are accumulating in advance. So we need to make sure that how to make a legacy of any activity taken care of, how we are training our staff, how are we training our partners from other sectors, the non-health sectors, how we're engaging with the community. All this eventually will spread out through the community and the system in general, and make it more robust and resilient in case of emergencies. And within the mass gathering health, the focus is usually on communicable diseases, on chronic conditions, exacerbation. So usually you will have people who have chronic diseases, hypertension, diabetes, etc. With some activities, if there is stress, physical stress, it might induce cardiac events, for an example. So those are also an important factor. The trauma and injury, because you have many people attending the event, so there is a risk of any type of injury. For many events, if there is some physical activity, if there is the high risk for trauma, and for substance abuse if there was part of that event. And then the environmental, and as mentioned, it's something of any natural event could happen. For our case in Hajj, the climate heat, where it will not be easy on many people who are coming from different parts of the world. So their heat-related illnesses, for example, is high on our risk assessment, and we take all the measures in mitigation and response for that. Moving on to the next slide. So when we are emerging from the pure event management to the global health security in this aspect, we are looking forward to share the knowledge and expertise in planning and managing mass gatherings and promote their role in global health security, expanding the network of global health security specialists and centers. So the idea is, as you're expanding and making sure that your capacities are being implemented or invested in the wider community, other non-event personnel will be more interested in hosting all the activities that support these events, and the networking will pay off for allocating all these resources. Also developing sustainable strategies for global health security, identifying knowledge gap, and devising plans for research and capacity building. And from the digital technology, we need to explore the use case. What are the examples or situation we can use this digital technology, and how we can invest in it in the most appropriate and productive ways to solve our problems and overcome the challenges. When we discuss the global health security in general, so the global direction toward health security should be comprehensive, collaborative, proactive, And I guess we're here going a higher level from the usual event organization to the health system and even World WHO level. The key principles are the governance, the multilateral collaboration with unified approach. We need to make sure that whatever decision is taken across one sector, it's repercussing to other sectors, it's making sense, it's being meshed into all the policy making that's working toward the safety of the hosting community and thereafter the event. Preparedness and resilience, the timely information, evidence-based decision making, and information sharing. So what we're looking forward that these events, there is lots of data that if shared, it will help enormously in allocating the resources. Otherwise, the planning will fall short and challenges will rise, and we're putting some aspects of the events at risk, and we will need to work very hard to avoid that. We need to invest as well in research, development, and innovation because the challenges in events are unique, and it depends on the factors on how we are hosting these events, how it's running, what are the features of them, and we will discuss this in more details in the coming slides. And the capacity building, as we discuss it, I will repeat the word capacity building all over in this presentation. We need to know that this is the cornerstone of all what you're doing in any activities for health system and public health in general. We need to make sure that there is an impact for what we're doing by having and investing in these capacities. When we're talking on a global level, so the health diplomacy and effective financing mechanism also will be involved. We need an adaptive and uniform, forward-looking, anticipating future challenges while learning from the past experience to continually improve. And here, the bigger the event, the more we need to look about our past experiences and then analyze it, dissect it, and even engage in dissecting and analyzing other global events. Although we appreciate how different they are, but the idea is the more we dissect and do this exercise, the better outcomes, the better way we can reflect and experience our own experience. So here we need to mirror what's happening on events to the pillars of health security in general or the pandemic preparedness. So the pillars are the governance and coordination on a national or a sectoral level, multi-sectoral level, the infection prevention and control, the risk communication and community engagement, the lab capabilities, either from the biosecurity, biosafety aspects, or when we discuss even the surveillance as it comes, the port of entry and international travel, the supply chain and logistics. Again, surveillance, we need to make sure that it's taking a very high spot area in the public health system to be able to monitor in real time and able to share all the data as we just discussed. The case management in case of we face such cases, the immunization, and we've seen, and even before the pandemic, much talk has been discussed on the anti-vaccination movement and how even before the pandemic, it was one of the health threats globally, and how it hinders the success, or it was a major challenge during the pandemic. While dealing with either any public health emergency, while dealing with an event organization, we need to make sure that the essential services for the host community are being met. They are not the victim of diverting the resources to respond or take care of an event. So we need to make sure that the usual operations, what are the critical actions that we need to make sure it doesn't fall short, how we are serving our host population, because after the event, they are still going to be there and we have to deal with the consequences. So events, it's local event usually, and it starts local, it ends local. We need to empower them and cover their needs. And the research, as we discussed earlier on. When we discuss considerations in general, the highlight is events were not created equal. So you might have a small event in a small city or in the outskirts of a big city, or the big city itself could host a global event. So we need to understand that the location has its own impact. Is it indoor, outdoor, what kinds of activities? what type of attendees are participating? Are they mere observers or they are engaged in the activity? Are they young uh, attendees who are celebrating or a cultural event, or they are elderly in a religious event? Definitely, by doing a full risk assessment for all these details, it will show us how different plans and resources needs to be done in advance. The public health systems and more beyond the public health, like all the sectors involved in any organization. So we need to understand here when we analyze the events, how these interact, and for especially people coming from pure clinical healthcare, that it's easy to conduct an RCT to isolate the confounders and come out with the discussion of this medication is better than this medication or intervention. In public health in general, especially in mass gathering, it's really different. It's really challenging. We need to capture and absorb all the experience we can get by doing our best, by reviewing all the literature, and try to come up with the similarities and differences in each scenario, and then draw our conclusion from there and working to improve our response. The emergency medical teams also is something of an emerging interest in the field, because we're trying to standardize the medical teams that are participating, what's the expectation, what are their competencies, and what role do they play, starting with what and ending where. So even with the transfer and referral for the cases from the scene. So this has to be standardized. So countries helping other countries in such situation will be easier to meet the expectation if it's agreed upon from the start. When we go to the behavioral sciences and mental health, we know it's a huge factor. What do we expect the behavior of the attendees are, and how things are being conducted? How are we able to spread our communication messages to decrease the risky health behavior, and then by which hopefully that we will have a healthy and safe event. The capacity we have discussed, either risk management in general, the risk communication and community engagement, the biosafety for the lab personnel, the EMS for the pre-hospital system, and even the courses we designed, and it paid off enormously again in the pandemic when we combined or organized specialized infection prevention programs for the non-health personnel about the basics of the infection control, so it will help them across as we in event organization. Areas of work again, while we're focusing on communicable diseases for health security, we still need to make sure that non-communicable diseases are being taken care of, environmental occupational health. In our situation, we're focusing much on heat-related illnesses in Hajj and Umrah. The health economics, how does this all plays out together? How we are allocating proper resources and maintaining the integrity of the system for the host community. And then as again, the behavioral science and healthcare delivery as well. Just an overview about the tools for risk assessment and resource planning. So for us, we have jointly worked with the WHO to do the tool framework, and hopefully we are working with them since after that, because this one came out in 2017, and we hopefully a newer version of an update will come out very soon. It discusses and dissects the system and make sure that we are able to capture the capacity, the vulnerability, and then work out the health risk in general for all these aspects, and make sure which ones of the risk are prioritized, and make your plans accordingly to mitigate these risks. As we are coming toward the conclusion of this discussion, I guess more could be discussed by any interested parties. We are hosting our 5th International Conference for Mass Gatherings Medicine in Riyadh, Saudi Arabia, at the end of October. Please, we welcome you to attend and participate, and hopefully much over these 3 days with the pre and post-conference workshops, we will be able to have more discussions, learn and exchange the experience We have an extraordinary lineup of speakers from all over the globe. So we look forward for your attendees, and we're happy to answer any further questions. We're even launching a special edition from the Journal of Infection and Public Health, one of the pioneers journals, with a special issue on mass gatherings and health security. By that, I conclude the presentation, and I'm happy to engage in further discussions, questions. The mic over to you, Jamie.
Brilliant. Thank you very much, Anas, for your insights into global health security and legacies surrounding mass gatherings and the importance of that. We've got some time now for people to engage in questions. So if there's any questions, feel free to write them into the chat or into the question and answer section on the webinar. So maybe we'll just wait a couple of moments as people pull together some thoughts that they might want to ask. Or not. And that's if you had maybe a top 3 considerations that you would look at in terms of legacies that have worked really well for you in Saudi Arabia, what would those top 3 things be, do you think, that people could perhaps think about when they host their own mass gatherings in terms of legacies for global health security?
Okay, so I'll start with a saying we have in our region, that the best deeds are the sustainable ones. So even though we are focusing as mass gatherings on these events, so we're having a very low baseline, near to zero, and then suddenly you have the event with this huge numbers of attendees in one location, and then after that short period, it will vanish. Yet, while we need to manage this event by any means, it's a celebration of humanity activity, different, it could be religious, it could be cultural, sports, etc. So the idea is you want to make sure that I'm reiterating the point of building capacity and sustainability. So we need to invest knowing that it's not only for these 3 days, few days, it's for a very long time. When you teach your all the personnel involved about public health and emergency management, so it will pay off, and hopefully when the day comes, you will be able to respond with the intended consequences being met. So we need to invest wisely and highlight how that these events from the public health emergency point of view are being taken care of, putting in mind that these activities of the planning, preparation, and everything we will be lifting this experience for a while. It will pay enormously. All the communication, because when I talk with colleagues from other countries, one of the major obstacles they face that no one knows anyone outside of their small circuit. But for us, we would know we have a very wide connection because we're forced to do that every year. And we have a long preparation before and after that cycle. So it gave us the opportunity to know each other, to know what are their obstacles they're facing. So we are volunteering to do it when we need to help or we can help. And when we have an ask, we know exactly what they are capable of providing because we know them very well. So this is also another point. The risk assessment point is something we're very proud of. We started way before the pandemic, and it's been ingrained in our planning system in general. So everything has been easy. If you face any situation, drawing a table and matching the risks and resources and working from there. So when the pandemic started, we were able to kick off this concept immediately, and everything was done in this in this manner. So we were able to proceed with full confidence. We didn't face any chaotic situation because our eyes were on the ball, that we know what we're heading for and what to do, how to allocate our resources. The training part was easy because how we're repurposing different types of resources was an exercise we were used to, and we were able to manage it promptly.
Okay, thank you very much. There's a few questions starting to come in. A couple in relation to, and you might have already answered this partially, a couple in relation to COVID-19 and moving from pandemic to endemic, and this year being one of the first times since COVID that the Hajj has opened proper again. What were some of the challenges in relation to that? How did you deal with that, and any of the key, I guess, legacy and takeaways for people in relation to Hajj this year?
Yeah, so in mass gatherings in general, for any health system, you are a support system. So perhaps any healthcare leader is used to be leading his own institution. The public health are used to interact around the clock with other non-health systems. So as soon as the pandemic took over the scene, so health sectors around the world, they were much in the driving seat or upon the front line to all the public policies. So from there, our risk assessment early on was, because of the global nature of Hajj and Umrah, we said it's a extremely high risk. And then the authorities announced a decision to halt international, and then near after to halt Hajj and Umrah all over. But the Hajj is the bigger version, which takes time in a specific period in the year. So when the time came, it was around July, if I'm not mistaken, in 2020. So the decision was to have a symbolic Hajj of only 1,000, and that was one of a kind in the history. To have it in such very small number, to hold it in symbolic, because Islamic people around the world, it meant a lot to them that this ritual was still taking place, but we needed to do it in a very special way. The year after, we picked it up to 60,000 from locals. And then the year after, it was the first year for international, we picked it up to around 1 million. And this year, 2 months ago, it was the first Hajj to take place actually in the pre-pandemic numbers. We were about 1.85. So it's expected even to grow more and more around the pre-pandemic numbers. We have Umrah, which is the smaller around the year number. It's a continuous, it's done in few hours. You can have anyone from anywhere in the world who wants to do who is a Muslim who wants to do the ritual. So, but these numbers currently are being to the roof. We're having very high numbers of people, especially with the recent ease in the restrictions, and even we have surpassed the pre-pandemic numbers. So these together just show us how the things are taking place. The challenge of how we're getting higher, it's been arranged with the concerned authorities. Actually, we have a designated ministry in the kingdom called Ministry of Hajj and Umrah, which its sole function is to organize for these activities. With still the Hajj committee, the higher committee is led by Ministry of Interior. The Ministry of Health is on the table. All of these considerations are being assessed in a very meticulous way, and all things considered, there are many implications because, as mentioned, many people from around the world, they are eager to come and perform this ritual. For them, they wait in lines for years. It's around if we have around 2 billion Muslims, so if we're trying to surpass the 2 million, so every year one for each 1,000 is only able to do it. And we are eager to provide the opportunity to as much as possible while keeping the safety for the event and everyone around. I hope
Great,
I
thank you.
answered. Unless he has a very specific follow-up, I'm happy to answer as well.
Yeah, thank you very much. A general comment in relation to the Global Centre for Mass Gatherings Medicine. Does your centre do any training for low-income countries that might be interested in better understanding mass gatherings?
Yeah, so as a WHO collaborating center, it's a mandate, and we're happily fulfilling this role. And we are called the Global Center because we need to make sure that any interested party around the world who's interested in receiving any support, that we are there for them. We are happy for any communication to follow through and arrange any sort of capacity building, training, etc., and assessment.
Great. Another question here. It's thank you for your presentation. What are your top tips for the humanitarian diplomacy aspects to get the resources to mitigate risks that you've identified? Talking a bit here about how you engage with other agencies and collaborate, particularly with security agencies and so forth.
So to answer this question, I will take off the mass gathering expert hat and I'll wear the disaster medicine hat because of my background. Because from a scientific point of view or from a discipline point of view, it's kind of different. When you're talking about a mass gathering, so it's an event usually planned, it could be unplanned in some situations, and it is for a certain occasion. But when it's an emergency that involves an acute response, so that goes out to other events and it's not considered a mass gathering per se. When you discuss the humanitarian, especially with what we're seeing currently, even in our region, so there is an earthquake in Morocco, and then there are the floods in Libya. So both of them are unfortunate events. You need to make sure that you are able to support the humanitarian needs. Sometimes you need to focus on doing a very rapid risk needs assessment, and then you take it from there, knowing that sometimes you need the resources that you will be able to manage, because we've seen in the past, and many publications has been published about very poor countries facing a humanitarian situation, and then when the help came there was no proper system to handle them, and eventually it's been a waste. So these things need to be as possible a framework put in advance, and then the translation of the details upon the situation. But the priority, the needs assessment, what are we able to conduct, that takes precedence, because otherwise it will be a waste resource and it might even exacerbate the problem for the people in the field.
Thank you. A really broad question here in relation to the Public Emergency Operations Centre. So what's the role of the Public Emergency Operations Centre? I assume this is in relation to Hajj. Do you want to talk a little bit about that?
So I'll try to cover some aspects for the Public Health Operations Centers. So the function is that you need an operations center where it captures all the data and it already have the needs, the resources, and will try to do its best to allocate and match needs versus resources in a prompt way. You could call it the public health, you can call it the health EOC. Names doesn't really limit your response or action. In our situation in Saudi Arabia, actually, we have 3 centers. One of them is focusing on the hospitals, about the clinical care needs, the other on the public health aspects, and then we have a 3rd one that's oversighting both and interacting with the resources, the supply chain, and everything. So it depends on the resources available. You have to start from somewhere, and then with the idea where you will reach. So in the case of Saudi Arabia, we have a sophisticated rooms with the dashboards, real time. It will show everything. Decision makers are there. They have been discussing this around the year. And then from there, you will say, okay, now we need to move this and match that need with this resource to make the best utilization of your resources in such a narrow time. You need to have this function is covered in any health system in general, and especially in an events or mass gathering. If a country doesn't have one, for example, then I advocate that starting at least for a mass gathering with a joint command center with all the event organizers. You start with a joint room, and from there you try to pick up and build your resources by training, by investing further, and to convince the organizer that you need more resources. Perhaps when you spread it out by the impact along the year with the ongoing operations, the case will be much easier.
That leads a little bit into the next question, which is about, can you describe the point of access for attendees that require medical care? How do you obtain some data in relation to that and analyze that across trends in time, whether that be hour by hour or day by day? Because this is about that situational understanding of what's happening throughout the event.
So I guess it's very specific and event based. So if when we describe events, there are recurring events, and then we have even the recurrent ones. We have ones that are being held in the same location, and perhaps just like the Olympics or FIFA, it's being recurred, but it happens in different locations. And then you have the sudden or one-time event. So it depends, because when you have your recurrent ones, you have a benchmark with yourself about how you will proceed. You are the one teaching yourself from your past experience. You know that this location is having the maximum healthcare seeking, so you need to allocate resources in that area. And from there, you try to make sure that utilizing mobile medical teams, virtual care. It depends actually on your resources, what you have, what your needs. A country with a good coverage, with a population that using their smartphones, you will be able to penetrate for their urgent, non-emergent care in a very proper way, and then you will be able to provide the appropriate answer or refer them where to go. On the other hand, if the activity you're expecting to have real emergency cases, so you need to have ambulances around, you need to make sure that you have access proper for either inside treatment or en route. You need to make sure that you have a very egress routes very clear for your ambulance to clear such crowded areas expected in mass gatherings. So I guess it's very specific based if you go into the details.
Thank you. Are there any more questions? There's no more questions online at the moment, but it's good to see many people. I can see the list of attendees. It's great to see many people, both from within WADEM and external to WADEM, joining our webinar today. Anas, do you want to have any final comments before we finish up?
So I guess many answers are very specific, and I'm happy to engage in any further discussion. As I posted my email, we're available on the social media as well and easily found. We're happy to answer any general knowledge discussions or very specific ones. If anyone is intending to communicate with us, we're happy to respond, and we can work something out from there. Again, thank you, Jamie, for moderating the session. Thanks, Andrew, for arranging for it. And I really thank all the attendees for making the time to attend this event. Thank you.
Great. Thank you very much again for your time, Anas. It was brilliant. Thank you.
Thanks, everyone. Have a good day. Bye.